Story time. In my original nursing career, I worked on our oncology floor. Patient received heparin, which is pretty standard procedure in a hospital. Patient had come to us after receiving chemo, and I don't remember what round of chemo they were on, but they were pretty deep into the regimen. Now, I was a brand new baby nurse, so I had just graduated nursing school. My first job was on knock shift on oncology, and this particular patient was one of my very first. When I do my assessments on my patients, the beginning of the shift, this particular patient is a little groggy. They just had chemo not long ago. They have stage 4 cancer. So they're just doing their best, but they're chilling. There's nothing that I'm concerned about, and they're stable. Their vital signs are as they should be. After 11 o'clock, med pass is at 10 o'clock where we do our standard big med pass. I start to notice a change in this particular patient. A change being that I walked into the room to do some sort of med pass or assessment, and I noticed the patient's eyes were bleeding. Not that they were bloodshot. Bleeding. They were bleeding. Fingernails of the patient also had blood around all of them. Patient's ears, where the patient had been scratching, were just hemorrhaging blood. There was petechiae under the skin, pretty much everywhere on the patient. And I thought to myself, well, that's odd. You see it in scary movies, and it's like, okay, that's a movie. But then when you see it in person, and you see someone's literal eyeballs bleeding, and their mouth bleeding, and their ears bleeding, and everything bleeding, there's definitely a different unsettling feeling when you're not expecting it. So can you guess what was up with the patient? I'm curious if you know. Comment below.